Hey, morning guys. So I decided that I am going to do a little review of the Persing's Respiratory Care Review program and lecture. I've had the book for a while and I know I've mentioned it to you guys a couple of times, but today, starting today, Monday, we're actually going to do the full course where Persing himself will come in and do lectures and practice tests, and we'll kind of go over all of this information that we've been studying and learning to hopefully help us pass not only our TMC and our CSE, but our exit exam for school, because if we don't pass our exit exam for school, we're not going to get far enough to take the TMC and CSE. So first step, pass my exit exam, which is actually this Friday, so it's kind of good timing to have the review course Monday and Tuesday. I'll have Wednesday off. Thursday I have clinical, and then I'll come in bright and early Friday morning to take my exit exam. Alright, so I'm gonna head in now because I have to figure out where we're doing the program. I think it's in one of our computer labs, but I have to figure out which one and get all of my stuff settled. So I will check back in with you guys either on a break or maybe after, depending on how things go, because it's supposed to be pretty busy. It's supposed to be from 8 a.m. to 5 p.m. both days. I'm sure I'll get a lunch somewhere, so I'll at least try to check in with you there. Okay, guys. But so we're on break right now, and so far it's actually been a really cool workshop. So we basically are going through PowerPoints that Gary Persing has created, and then we are doing various pieces of exams that correlate to the different subjects we're studying, and then he gives us a kind of like time frame that basically correlates with the type of time frame we would need for the TMC. And then we go through each question and he really explains in detail the rationale behind each one. So it's actually a really great review. So right now we're on lunch break and I'm sitting in my car, and it's Las Vegas, so it's super freaking hot, which explains why I'm probably like all red-faced and sweaty and gross. But so I'm gonna go eat, and then once we come back from lunch, we're gonna start working on clinical simulations instead of focusing on the TMC. I think we have one more test for the TMC, and then we'll go over those questions and then roll into clinical simulations. So primarily we've been working on like information gathering, and actually I'll tell you about that at the end once I have the paper in front of me, because I don't want to say it wrong basically. So I'm gonna go eat and take a couple of minutes to let my brain relax from all of the testing and additional information and tips and tricks and stuff. And then we're gonna go back and do some clinical simulations. So I'm excited to see how he kind of goes over that information. But I guess that's it for now, and I will check in with you guys once I finish the first day. Okay guys, so I am the worst vlogger ever and forgot to update you after I finished the first day of the workshop. But I figured since I'm a little bit early today, I could kind of talk to you about what we did yesterday, and then that'll roll into the second day. Okay, so the first day we started out, got to know everybody, introduction, things like that. And then we were given PowerPoints basically that kind of correlate with the exams that we're doing, and this workshop is full of a lot of mini exams, which is really helpful. Of course, first you do the exam to see kind of where you're at and see where you're, lacking in knowledge or maybe need refreshers because it's things that you haven't talked about since your first semester of respiratory therapy school. And then once you finish the exam, Mr. Persing or Gary goes through each question step by step and really breaks them down and kind of gives you the different tips and tricks of how to do equations faster, different pieces of information, really how you should be looking at these tests and what the MBRC is looking for when they do these tests, because a lot of the time we know that real world and test world are a lot different. So it just kind of helps you get in that mind frame of how you need to be thinking to take that particular test and the kind of the progression of steps that they're looking for. So the first day we did, sorry, I'm looking at my paper here to make sure I get it right for you guys. Basically we did patient data, evaluation, and recommendations. And there were multiple tests. I think we had 1, 2, 3, 4, 5, 6, 7, 8 tests, or mini tests. I mean, 10 to 30 questions each. So that's really not that much if you think about it, because when you take your TMC, there's a total of 160 questions. Only 140 are graded, but this is nothing compared to that, of course. And then we also did troubleshooting and quality control of equipment and infection control, which that was really good to go over, at least the infection control stuff, just because I haven't looked at a lot of that since first semester. And in the hospitals, they give you specific types of wipes and solutions that you can use to clean equipment, and some of those infection control questions go into things that we generally don't clean when we are on the floor and working. Sometimes an outside company cleans it, or just whatever. As well as quality control, that was good to go over also, because unless you are in the blood gas lab, or that is one of your assigned duties, is quality control of the ABG machines, or co-oximeters, anything like that, or if you're in the PFT lab, things like that, you're not going to run into that a lot on your clinical unless you happen to get lucky enough to get into one of those labs while they're doing calibrations and quality control. So it's good to review that as well, and you give us a lot of good information and tips and tricks and on how to remember it. And then we also started initiation and modification of interventions, which is where a lot of people get kind of caught up, because they think, oh, do I need to do this or that? Do I need to increase the tidal volume or the rate? But the tidal volume's already high and the rate's already high, so he just kind of goes through and helps you work out how to select the best option available. We did also work on a few clinical simulation exams or tests, or clinical simulations, whatever. Sorry, it's early and I'm under-caffeinated. And that kind of ended our day. But today, our second day, we're going to continue with initiation and modification of interventions, which is a fairly long section. And then talking about specialty gases and family education, special procedures, high-risk situations, things of that sort, and then also ending again with clinical simulation. So far, I really, really like the workshop, because even though a lot of the things in here we've kind of touched on, Gary really dives into them and gives you so many opportunities to use the information that he's giving to you. It really solidifies it in your mind and kind of makes it stick. As well as he's just a really good teacher, so the way he explains things and breaks it down, because he's been doing this for a very long time, he knows kind of where people struggle on those exams, and he's very familiar with the types of questions that you're going to commonly see on exams and the types of answers that the MBRC is expecting. So overall, it's been really great so far, and I'm kind of excited to see what we do today, since it's the last day. So basically that's it for now. I'm gonna go in and get settled and get ready for the last day of my workshop. And then this Friday I will have my exit exam for the program. Look at that, I'm already getting nervous over here with my tight fist. So our exit exam is on Friday. So I have this workshop yesterday, Monday, today, Tuesday. I've got Wednesday off, clinical Thursday for about 12 hours from, actually, that's a longer day than 12 hours. I end up getting to my clinical location at 5:30 a.m. and then I leave at about 7 p.m. if I'm lucky. I might leave later than that depending on the day. So that's actually a very long day, unfortunately. And then I will get up bright and early the next morning to come in and take my exit exam. So I will let you know how the rest of this day went for the second day of the workshop, as long as I remember. And I guess I will check in with you guys. Okay. Alright guys, so I am finished with the 2-day workshop, and overall it was a really awesome workshop. Gary Persing himself, as I've mentioned before, I think came out and actually conducted the workshop, so it was really great actually getting to speak to the author of this book that I've been telling you guys about for, you know, the last year or so, and you know, getting questions answered and actually hearing his thought process behind and hearing how he composes the book and puts together these simulations and really walking through each clinical simulation. We did a couple of those today, just step by step. That way you can really understand why you're picking each thing and kind of get that reassurance that even though you feel like you're doing something wrong, because a lot of the time on the TMC and the CSE, they're not going to give you the best answer. There are going to be cases where yes, the best answer will be there, but many times there's going to be the second or third best option, because they want to know that if you don't have the best available option, that you know what to do next. So it was just really good getting to go through everything. Gary, he himself is very kind, an excellent teacher, and we may or may not have nerded out a little bit, my classmates and I, and asked him to sign our books. But just overall, I loved the whole workshop. It was really great. It created a lot of dialogue between all of my classmates and the other semesters and a few people in the workshop as to what we were doing, why we were doing it, and it really built a lot of confidence in going into my exit exam this Friday, and then my TMC exam and CSE hopefully within the following weeks after I graduate. So overall, I would definitely recommend the book. I've been telling you guys that I love this book for the past year anyways, because it is set up so clean and direct. It gives you enough information. Obviously, this is not going to be your primary learning tool. You should have learned the majority of these things throughout your program, but it gives you enough information to review, as well as it really hits the high points, and Gary really has a tendency to focus on what he's noticed a lot of people struggle with, and he's also very honest. So with this, again, it's very easy to digest. I've read and looked at some of the other material where it's too much information, and then you're just sitting there like, oh my god, what is important? Do I have to memorize every tiny little piece of this book? Obviously, the more you know, the better, and even if you know most of what you're reading, I think it just feels very overwhelming to have, you know, these giant books put in front of you filled with information, and you're just sitting there thinking, oh my god, this is so much. So again, I like that it is very condensed. It's to the point. It gives you enough detail to understand, but it doesn't keep sitting there and saying the same thing over and over. It's not super repetitive, which I also like. It's just very direct and to the point. So overall, I guess that's it. The real test is going to be this Friday, so I will check back in with you guys on Friday to kind of talk to you about how my exit exam went, and wish me luck, fingers crossed.